Healthy communities and social prescribing. Working with communities to deliver better health for all. In this video, we'll explain the Healthy Communities and Social Prescribing Work Programme, what it is, how it fits with other health inequalities work, and what we are aiming to achieve through the programme. We'll share with you some of the work that this programme is driving forward across the North East and North Cumbria, and let you know where you can find out more. You'll hear from some of the people working on the programme and from some of the people enjoying improved health and well-being thanks to the programme's work. This programme is one part of our wider effort to tackle health inequalities across our region. Funded by the ICB, we are part of a £13.6 million programme to deliver healthier lives and fairer outcomes. Our Integrated Care System, or ICS, wants to deliver better health for all its people. To do this, we need to be better at making our health and care services work for everyone. Many marginalised communities find that traditional health and care services don't work as well for them, and they are the people who need that help the most. The Healthy Communities and Social Prescribing Programme focuses on how we build on the strengths of local people and communities to support each other, using the skills of the voluntary, community and social enterprise, or VCSE sector. So what are we trying to achieve through this work? First, we aim to tackle health inequalities by working with local people and building the support available from their own communities. We want to promote community voices, making sure that people have a bigger say in how they access and use services. Social prescribing has a key role to play because so many factors affect someone's health and well-being. Social prescribing is one way we can help people to build healthier lives. So our programme aims to build and strengthen social prescribing systems. We are also building on the great work done by volunteer health champions. They proved vital in helping communities through the pandemic, and we want to work with local authorities and local health services to make the most of health champions to tackle our health and care priorities. We also want to influence the way that services are designed and delivered by promoting more cooperation between partners and more co-production so that services are designed by people rather than for them. We want to promote investment into the voluntary sector as we know it can deliver results on the ground. And finally, we want to build the evidence base for social prescribing and other community-based approaches so that we can inform future plans to reduce health inequalities. So, what is social prescribing? Here's a simple definition from the National Academy for Social Prescribing.
Social prescribing is connecting people to activities, groups and support that improve their health and well-being. It is connecting people to non-medical support to address any issues and unmet needs. This might include helping someone who's isolated to join a befriending group, an art class or a community gardening project based on what works for them, connecting someone struggling with financial stress to a service that helps with managing debt or claiming benefits, supporting someone with dementia to join a dementia choir, enabling them to maintain a sense of social connection, or working with someone with high blood pressure to take up a form of exercise that they're comfortable with. Social prescribing can help change the circumstances that make people unwell. It can empower people to manage existing health problems, to get the right benefits, or to get back into employment. It can help people to connect and to grow in confidence.
Importantly, this approach looks at the whole person, not just the medical symptoms. It puts the whole person at the centre and looks to develop a plan with that person that can lead to positive change. The reason that we build and promote social prescribing is that we know it works. There is plenty of evidence that it delivers results and can save the NHS money by addressing some of the causes of poor health and well-being. It is one of our most important tools in addressing health inequalities, but needs investment to make sure that it works across our region. Social prescribing schemes can deliver between £2.14 and £8.56 for every £1 invested. Through our programme, we're investing ICB funds into social prescribing systems. Our VCSE partners are working to identify social prescribing gaps and meet unmet needs, bring together key partners so that we can learn from each other and work more effectively together, develop systems and ways of working that make it easier for people to find or be referred to support in their local community, identify the barriers to good social prescribing and help find ways to remove these. Here's one of the projects funded through our Healthy Communities and Social Prescribing programme. Hartley Power, the local infrastructure organisation in Hartlepool, used the funding to employ a development worker. Dawn worked with the local young person's social prescribing link worker to see what more could be done to support the town's young people, especially those with special educational needs and disabilities. Another strand of our work focuses on health champion programs. Health champions are trusted members of the community who volunteer to help promote health and well-being in their communities. Health champions are a vital link between public health and local communities. Not only do they help get vital information through to local people, but they also help to make sure it's provided in the best way and can feed concerns and questions back to professionals. Through our work, we're gathering and sharing learning to build bigger and more effective health champion projects right across our region. Here are two health champions who've been promoting public health in Gateshead.
For me personally, I like meeting deaf people face to face, sharing information on health, providing information that they did not previously have, and access to what they have not heard before.
If a member here was worried about a particular thing with COVID, I could go back to Louise from the public health team, give her that information, and then she could give me information back to help relieve that worry, so that when I went back to the group, they knew that guidance and information. You never know what you're going to get out of it. You might bring something to the table that they might need, or they might bring something to the table that you might need, or there might be a connection you didn't think you would be requiring, and it will help.
The Healthy Communities and Social Prescribing programme also supports Reading for Wellbeing. Spearheaded by local author Anne Cleves, this project provides funding and training for local reading workers based at libraries throughout our region. Participants tell us the huge difference that taking part in Reading for Wellbeing has had on their lives. People like Ian.
I was referred by my surgery to the Community Link team. Patricia was assigned to look after me, to find me something that would enable me to leave the house because my shopping was delivered. I didn't get on a bus, I didn't go out, I was locked in my own world. And Patricia was so kind, she was looking for options, she was looking for things, and this particular day she said, there's a project in Choppable Woods, it's an Anne Cleve Reading for Wellbeing. The words reading, well-being, and a lovely day in the woods was something that I thought, yes. Even on the day, I had 1,000 reasons why I couldn't actually step over the door. But I got to Choppable Woods, I recognised the voice of Helen, Chrissy, and obviously I met Anne. And even there was a news crew there on that day, and they said, would you mind doing an interview? I thought, it took me all my time in 18 months to get here, now you want me to go on the TV? Anne's words always ring true with me. She said, we need to have a bit more courage like Vera. That stuck with me. And what I said on that day was that somebody threw me a lifeline. From that moment, my life changed. My life suddenly became purposeful.
We want more people to get involved in our work. To find out more about healthy communities and social prescribing, and to keep up to date with our news and events, join our network via the VONNE website and our social media channels.